confused issues. There is this belief, Mpo, that healthcare is free in South Africa, but not in any other country in the world. And I want to correct that. Healthcare is free for children under 6 and young women. That was declared by our founding president, Nelson Mandela, in 1995, I think. Yes, so we only offer free healthcare for pregnant women and children under 6 of whatever nationality. The other people are not offered free healthcare. They are charged, but the problem is if you come to hospital without money and there's an emergency, there's no way you won't be treated, because then the Department of Health will be sued. It will be litigated in a way unimaginable.
So, as you've heard from Dr. Aaron Motsoaledi, the Minister of Health in South Africa, the issue here, it goes back to that biometric identity. So let's help him to figure this one out, because it's so easy. So on the left is the current system. So as he said, in emergency, people get treated, must be treated. That is a standard way how we manage these cases. We treat first and ask identity later. So when the patient arrives at the hospital in South Africa, often with no ID or even false details, the hospitals open a folder, but there's no link to Home Affairs or SARS. So treatment is provided, the patient disappears, and the claim goes unpaid. In the end, the citizens, the South African citizen and the taxpayers, they carry the cost of that treatment. So let's have a look if the biometric system was introduced and linked to immigration and employment. This is on your right side of the screen. The patient, emergency, is still treated. The patient is scanned, finger scanned, and their identity is instantly verified through Home Affairs. If it's not verified, undocumented, the patient will still be treated. But the Home Affairs will know that the patient arrived unidentifiable with this identity, DNA identity, and this number as, undocumented. So they'll have this data in their records, all right? So if they are citizens or legal resident, they can be linked to NHI or the unique patient identifier, depending where the process of NHI is in South Africa. But unique, let's say there's no NHI, but in just unique, maybe linked to unique identifier, patient identifier, they will be billed through employment records based on whether they work or not work. So if they're undocumented, as I said, they still receive emergency care, but they are flagged. They are flagged to the people who are responsible for border in South Africa. You cannot keep on allowing this lawlessness to continue. They are flagged to the immigration officials. They are reported through that linkage of the system and handled through that legal immigration system. So they continue to be treated because healthcare is access, it's emergency. So the result is that there is a traceability, there is also accountability, and there is a protection for citizens and legal residents and immigrants and legal immigrants in South Africa. So it also remove a lot of stuff, because then everyone gets the same identity number, like NHI, or card or whatever that's linked to everything about them to Home Affairs. And you really going to solve this problem of payment system, because you will know who are people who are unidentifiable into your system, and you'll start having records. That records that drive healthcare. Can't run a healthcare without any records. Please, people, how are you going to plan for services if you do not have data, real data about who is actually using the services? What is the profile of the people that are using these services? Who are they? Give me a profile of a person that uses public health system. They don't have an answer about that. And it's a catastrophic failure in healthcare if you do not have this part. This is a modern healthcare now. We need to know people, what they do, their lifestyle, and what they are. And also you could also be thinking about even care in the long term, the follow up. If you don't know who they are, then it's a big problem. It's a failure in care. So this is a problem, it's not the whole problem. He just have to implement the biometric into healthcare and the unique patient identifier and the healthcare card access, that it will actually be able to identify the patient. Even if the patient is undocumented, they will create new one. That patient will have that identifier. It doesn't matter. Hospitals are not responsible for immigration. The immigration will know that the person who's created this identifier appeared in the hospital. These are the records. They may follow up with that according to the immigration records with the person. But it is going to make it easier to understand what's happening in the healthcare system. Being able to track, and also I suggest in this issue, be able to track the script, that is whatever the prescription that's going to be prescribed to this person must be tracked, and the healthcare worker must be registered to that script monitoring system, so that you be able to track who was the prescriber, who is the patient, what was the condition, okay, how much, what was the quantity that was dispensed at the pharmacy, okay, and who was the pharmacist. You need to know all this stuff. This is important around managing the stock as well. So where is the issue. Are the medicine being sold to a ghost patient? It will remove a lot of ghost patients. You're able to know in real time what's happening in the healthcare system in South Africa. In real time, like say getting up in the morning, you will know what was happening yesterday in the healthcare system in South Africa, because you'll have a data center where all of this information would feed into, be able to see what's happening. And the minister will be able to see which area needs a lot of support. At this stage, you do not know what is driving this issue, whether it's driving by criminal syndicates, whether it's driving by a ghost patient. You cannot say what it is. But you can't be keeping on giving money to this thing without knowing exactly what is the diagnosis. It's what we're told now by minister. It has say it's just based on indirect assumption, but we need real data about what's happening. And the only way we can do it is have a biometric identification and script monitoring system that is linked to every prescription that is issued by a prescriber to a patient, and to who dispensed that medicine, who gave the patient that medicine, and the patient collected that medicine. You need to know this information. It's it's actually a standard practice now in most countries to have system like that, because it helps to identify problems around divergence. It helps to identify misuse. It helps to track critical medicines that people need. You cannot have people running out of the ARV, because they can create a huge problem with resistance. So you need to be on top of this. So it seems like people think this issue of identity is, kind of like, oh no, it's taboo, you shouldn't have identity. You must have it embedded in the system, and it must be embedded in the system upon opening a file, not at the gate, not the Tula style, at the system entry inside the hospital, inside the clinic. All right, so this is what is needed. So we can have this data and be able to analyze it. This is why the identity is important, but I don't agree with the standing with the gate thing. You need to do it in privacy inside there, and be actually through the opening of the file. And you would see that this whole thing actually will solve this problem out. And you'll be able to see, the minister will be able to see exactly what's going on in the South African hospital. At this stage, he's just making speculation because he doesn't have the data. There is no innovation in this healthcare system in South Africa. They just don't innovate, the ANC people. They asking for money. You're giving money for something that you hope at least this time they're not gonna, you know, hire someone like Vusi Musiket Maklala. Okay, so now we can't keep doing that. We need data now. We need to data will help us to diagnose the problem. And how we get the data, we get biometrics. We get everything integrated to Home Affairs, to UIF, to integrate it to employment, SARS, everything integrated upon opening a file. So we can even track people to payment. There's a reason why he can't track payments, because he doesn't ask for identity. Duh, that's so simple. Identity is what verifies that a person lives where they live. Is to ask the record and confirm and who they are, and then verify with the Home Affairs, whatever UIF, whatever the identifier, who they are, and send the bill there. If they are not identifiable, it's okay. You know that they're not identifiable, and you must have a process. What is the limitation in care for unidentifiable person until that person gets identified? What are the provisional care can be offered if it's not emergency? All right, he has to come up with these laws, and they have to be tight. So really, it's the issue of, like I said, it's the issue of administrative. This issue, it has to do with the ANC. The ANC created this problem. They have not planned out through these laws properly. They have not implemented the policy and the work instruction on the ground. That's why we're here today. It's because of the failure for administrative and monitoring and also planning, because they weren't even looking at collecting data appropriately. And there are reports in some other neighboring very busy neighborhood around South Africa that actually a lot of people were using these services. Immigrants are actually undocumented, about 70%. That's not acceptable. And this is go back to the Home Affairs. It's not acceptable to have 70% of undocumented people using public health services. So it's not acceptable. This is lawlessness. So you need to tighten this loophole and make sure everything is streamlined, very well streamlined, so that you do not disadvantage citizen and legal resident for this mess. Okay, so you see genuine patient, and if they are not documented, it's okay, you can see them. I mean, you're not going to stop people from accessing care, but you need to decide what type of treatment they must have. Vaccination, important, everyone should have it. So it's up to the government to make this decision based on the needs and the actual population outcome. But you cannot actually enable illegal migration. If people are not able to go back to Home Affairs, if they've been identified as undocumented, that they need the hospital needs to have a provisional time where they can continue to give them chronic management until they get to Home Affairs. And that has to be set up by the department. How much? 6 weeks before they can get to Home Affairs? Yeah, to go and sort out their things up to Home Affairs, because you cannot continue to enable this lawlessness, this tourism, this medical tourism, birth tourism that's happening there. It has to be stopped. You gotta make sure that you make sure the healthcare system is sustainable for everyone who live in South Africa. Okay, that is the goal, to make sure you do not actually take the burden of these neighboring countries, who actually, by the way, I had a look around, they don't have budget. They don't budget for the citizens. They do not budget for the citizens. It's unbelievable. How can you run a government? You don't even have a budget for healthcare. Shocking. Anyway, let me go. Thank you guys for listening. See ya.